Trying to conceive and feeling overwhelmed and confused with unhelpful information and advice? This podcast is for you. Welcome to Don't Tell Me to Relax. I'm your host, Hannah Pern, a fertility acupuncturist and passionate advocate for better fertility education and support. Our aim is to empower you with information to support your fertility journey and provide a community for connection with people who get where you're at. If you'd like to join us or work with us in clinic in London or across the UK, all the information is in the show notes at the end.
AcuPip's sponsors Don't Tell Me to Relax. If you're looking for a way to naturally balance your body, calm your mind and relieve anxiety, then AcuPips has the answer. AcuPips is the UK's original ear seed company, founded by traditional acupuncturist Zoe Young. Ear seeds are small seeds or metal balls attached to an adhesive and placed on pressure points on the ear in specific combinations, creating balance within the body. Discover more today at acupips.com and use code RELAX for 20% off site-wide. AcuPips, modern healing, ancient practice.
Hello and welcome everybody to today's show. I am joined by Dr. V from Fertility today, all the way from Greece. Fertility are a fertility company based in Athens, and they do a lot of testing, and their goal is to really make testing more accessible for people around the world who want to investigate their fertility further. And what I like about Fertility and why I've asked them to come in and speak to us today and why we've got Dr. V here is one of the sentences that they say on their website is that they believe unexplained infertility is not a diagnosis, and they prefer the label of unexplored instead, which I think will be a really important sentence because I know lots and lots of people listen to this podcast really looking for answers around their fertility. And many people who listen to the podcast are diagnosed with unexplained infertility. So I'm really interested to hear more about that. So Dr. V, would you like to introduce yourself and your background and tell us a little bit about the company Fertility that you work with?
Yes. Hello. Thank you for having us, Hannah.
You're welcome.
My name is Panagiotis Veneratos, hence Dr. V. My name can be a little bit complicated to easily memorize. I don't mind. I actually like it. It's a cool nickname. Now, I am I'm a biologist, PhD doctor, specialized in research in female reproduction. I have my PhD from the medical school, and I have 2 master's degrees. But my expertise comes from experience, I believe, because I have been dealing with this matter with unexplained infertility, essentially, for most of my career. It's more than 10 or so years, maybe 15, I don't know. I didn't really choose to do this, to specialize in this area. It sort of chose me because as it happened, as I found myself working with couples struggling with infertility and difficult cases, termed unexplained, I realized that I had to do lots of research and lots of reading upon the subject because I wanted answers. So this is how gradually we arrived at Fertility. Fertility was a goal of ours, a dream of ours, to be able to gather all useful knowledge and important information and important research and new methodology in one place to be able to help couples that most tell them that they cannot be helped, basically. And this is what unexplained infertility is as a diagnosis. Actually, it's the lack of diagnosis when we don't know what's going on. This is when you get this. But in my experience, we found out that essentially it's just that the investigation has stopped short before the real factors, the real reasons behind the problems have been revealed. It's as simple as that. And in most cases, if you have the expertise and you have the methodology and the means, you can relatively easily uncover the reason behind the problem. And since most, if not all, problems have specific solutions, we can fix it as well.
Yes. And am I right in that you work a lot with people who have had miscarriage, recurrent loss, repeat implantation failure?
Yeah. For better or for worse, we work with the most difficult cases.
Yeah.
We very rarely have a couple that has just started their fertility journey and they're struggling a little bit. This only happens if they happen to have a friend that has found the solutions through us. Usually, what happens is that after having been failed by most of the system, having years of unexplained infertility, recurrent pregnancy losses, failed IVS with donor eggs, donor sperm. They have tried everything. Eventually, they find their way to us.
Okay.
And so most of our cases are like this.
Yeah.
It's either primary or secondary infertility with recurrent implantation failure or pregnancy loss and years of struggling.
So, can you tell us? I know you do a number of different tests, and I would love to talk about the other tests another time because I feel like we only try and
Hmm.
keep this show to about 30 minutes. So, the one that I'd like to focus on today is around the microbiome testing that you do,
Hmm.
because obviously, there's a lot. We've done a number of episodes on microbiome already on this show, but your test is quite different to anything that we've talked about before. So, before we go and look at the test, can you tell us about why the microbiome and the female microbiome is becoming such an important field in the world of fertility?
Okay, yes, I can. First of all, the interesting fact about the microbiome is that until relatively very recently, the scientific community believed that the uterus was sterile. That's an interesting fact. That was something that a belief that was prevailing for about 100 years. Funny or even ridiculous that it didn't change for that long. Anyway, we are slowly discovering that, like most systems in the human body, the female and the male reproductive tracts also have their own community of bacteria and microorganisms. So they have their own microflora, their own microbiomes. And like any other system in the human body, the microbiome is part of that system. So it's part of the human physiology. It's not just a bunch of bacteria that you hope they're not pathogenic. The specifically for the uterus, for example, the uterine microbiome will regulate almost all aspects of uterine functionality. So everything from the biochemical environment of the uterus to cellular and chemical communication between the lining and between the embryo and the immune system, sensitivity and responsiveness to the female hormones. So how your lining responds during your cycle to your hormonal signals. Um, Obviously, it protects you from pathogenic bacteria, regulates which microorganisms are allowed in, which are not, which are allowed to grow and which are not. And also, it regulates how your immune system works locally within the uterus, which is extremely important because this is maybe a topic for another discussion, but the immune system is a major layer for fertility because because of the simple fact that the embryo is not immunologically compatible with the mother. So we need to have a very calm, baby-friendly, and immunologically receptive environment and tolerant environment for the embryo. And all of these areas fall under the control or the effects of the microbiome. So
Yeah.
the bacteria that grow there, through micrometabolites, chemicals that they produce, they can affect those. So we know it is extremely important. We know that a normal microbiome needs to be dominated by a group of good bacteria called lactobacilli. And we know that these need to be more than 95% of the total bacterial mass. This has been shown with many recent publications. And we know that when this is not true, when the lactobacilli are lower than that, we have lower rates of fertilization and pregnancy, clinical pregnancy and birth rates. And also we know that when these are increased to the normal levels, then we have increased rates of implantation and pregnancy rates and birth rates. So we know that. So that's what is normal. So under normal circumstances, good population of bacteria will regulate everything, will keep other potentially harmful bacteria at low levels where they should be, not causing problems. But we found out that it is not uncommon at all, especially within the infertile community, for various reasons. It could be external, it could be because of something internal, something an illness or stress or something external, medical intervention or medication. So for various reasons, it doesn't matter, that women can easily lose part or completely lose this beneficial population. So when this good beneficial population collapses, then this leaves open space within this ecosystem, and this cannot be. You cannot not have lactobacilli and have nothing instead. This is not possible. Something else will fill the gap. And then one or more species from what we call opportunistic pathogens, these bacteria that live within the microbiome, but are, when at low levels they are harmless, they take the opportunity, they grow, they expand, and they can take over. And then they become pathogenic. Once this is done, then we have what we call dysbiosis. Dysbiosis is a term that describes an abnormal microbiome. Now, it is important to understand that you can have dysbiosis by bacteria that are inherently pathogenic, so they are necessarily harmful, like, for example, mycoplasma, ureaplasma, that sort of thing. But also, you can have dysbiosis by bacteria that are not inherently harmful. So they're not bad for your health per se, but they have created a new status quo, a new balance, which is, however, incompatible with pregnancy. So that's also a problem. So dysbiosis can have symptoms. It can have things that you can detect. You can have BV, you can have infections, you can have inflammation. I will discuss about that. But you could also have nothing, and the only symptom be infertility.
Mm.
Okay, so that's that's how the problem arises. Now, when you have dysbiosis, that can result in a number of things. First of all, having lots of bacteria that shouldn't be there growing in the uterus can have a directly harmful effect on the embryo that is trying to implant. Bacteria that can produce toxins can be directly harmful. As I mentioned, the chemical environment will be different. The way through which your body, the cells of the lining of the uterus will respond to hormones, will communicate with the immune system, with each other, will change because they will get different signals from different bacteria. So the whole process of implantation can be disrupted. And there are two major things that can happen, normal microbiome. The first one is something that is very well known. It is a chronic inflammation of the lining of the uterus known as chronic endometritis. Chronic endometritis is usually silent.
Mm.
which means that you don't know that you have it, and you can have it for years. And about 40% of women suffering from infertility have it. So it can be mild, and it can be reducing your chances of getting pregnant, for example, but it could also be more severe, which could directly stop and absolutely prevent implantation. This can lead to implantation failure, but also you could have a poor quality of implantation. So shallow implantation leading to chemical pregnancy. You could have ectopic pregnancy. You could have lots of things because of that. So chronic endometritis is one major result of dysbiosis. The second major effect that an abnormal microbiome, dysbiotic microbiome can have is how it will affect the local immunological profile within the uterus. When your body fights an infection within the uterus, or it believes it is fighting an infection within the uterus, that would cause an immunological mobilization. It will cause a recruitment of toxic elements of your immune system into the uterus, including cytotoxic peripheral blood natural killer cells, and production of pro-inflammatory signals, such as pro-inflammatory cytokine production. And this is exactly the opposite of what we want for pregnancy. Because for pregnancy, we need to have a very calm, immunologically tolerant environment and baby-friendly environment within the uterus. And when you have dysbiosis, there is a transition towards a pro-inflammatory response called the Th1 response, which is not compatible with implantation in pregnancy. So that's another major result. This could indirectly harm your chances, or directly it can harm the embryo, because when you have the immune system fighting bacteria, it is like it is waging war,
Mm.
and the embryo is caught in the crossfire,
Mm.
so to speak. So these are the major effects of an abnormal microbiome.
And when we've talked on this show about microbiome previously,
Mhm.
we've done a lot of stuff around vaginal microbiomes
Mhm.
and using swab tests to test vaginal microbiomes. And we often talk about that in the context of having BV or thrush or some kind of
Correct.
dysbiosis that you may have picked up
Mhm.
in the past, or you might have symptoms at the moment. But your test is very specific. Well, tell me, because I might be
Mhm. Mhm.
supposing incorrectly here. You're talking about the uterine microbiome, which is different from the vaginal microbiome, but I presume it is linked together. The two are linked because they are
Correct. Correct.
connected.
Correct. So you have exactly because of what you are saying, because you have two distinct microbiomes, two distinct microbial communities, which are nevertheless connected through the cervix.
Mm.
And you can have bacteria going back and forth. Usually it's from the lower towards the upper genital tract. These are called ascending infections. And because they are linked, we make a point of testing both. So our test uses both the menstrual blood as a means to access the uterine microbiome and the vaginal swabs to access the vaginal microbiome, because you cannot have only one without the other. You're only getting half the story. It is not a good practice if you have the option. Okay, if you don't, you can work with what you have. But if you have the option, you should get the information from both microbiomes, because you don't want to miss an infection or a problem that can reinfect the other one later on.
Yeah.
Also, you can get an idea of the severity of the problem. If, for example, something that is only localized in the one or in the other, it could be of a less severity than an infection or a problem that has established across the reproductive tract. So we use both. Essentially, we have two microbiome tests, and then we look at the data together, and we give a diagnosis overall.
Okay. And so if people are listening to this
Mhm.
and they are interested in doing the tests themselves, I presume that they don't need to go through a practitioner or a partner to do the test. They can, or people can order the test themselves and
Yes,
do the test at home and then send the test kit back to you in Greece. Is that right?
correct. So the test itself is one great part of the innovation that we have. The other good news is that this can take place from people's homes without the need of a doctor or the help of anyone. You can just order online. You will receive the fertility kit, the fertility box. It's a very nice box, has a nice wrapping, but essentially it is a kit that helps you, has all the information on the stuff that you need, the vials, everything, to collect the samples yourself. So a small amount of menstrual blood can be collected early on day one of period. It's very easy. It can be safely stored if you're not ready to ship right away. It can be stored in the freezer and stay there almost indefinitely. And a couple of vaginal swabs that you can collect yourself again, either before or following your period. So that's it. Very easy. Once you are ready, you just again log on to the website, request pickup, and we will take it from there. We will have specialized courier service come to your house, take the box. It travels at ambient temperature. Very easy to do, and you will have your results very soon after.
Okay. And so tell us when you get your results.
Mhm.
You know, microbiomes are complex to understand. So, how do you deliver those results to patients or people who do the test so, you know, they can understand what it actually means for them and their situation?
Okay, Hannah. So this is a very important question because we have been doing this for many years. Okay. And we have been working with this sort of sample type for many years in addition to that. Lately, there have been new tests, new companies offering microbiome tests. The major problem there is interpretation of the results. Because as far as the methodology is concerned, I don't find a problem with other methodologies. I'm pretty sure they're quite good and robust. The thing is that if, let's say, I give you a percentage of one microorganism, 20% of Gardnerella vaginalis, what do you know about that? Is it bad? Is it significant? Is it moderate? Should you treat it? Could you leave it? Could you take only probiotics? You need antibiotics. So, by giving you a list of microbes and telling you, letting you know that with a general diagnosis of normal or abnormal is not enough. So, what we do is that we give individual on the side of each result, we have an individual ranking in terms of clinical significance so that you will know whether what you have is significant or not. Keep in mind that 80% of one microorganism may be fine or mild problem, and 20% of another one could be major. So we give the clinical significance, and then we combine everything in a diagnosis that tells you exactly how significant what you have. So I will tell you that you have this sort of dysbiosis, which is of moderate or mild or high clinical significance, and whether it is suggested or strongly suggested, for example, to have that sort of treatment. And we will also suggest specific type of treatments, specific types of antibiotics. Obviously, obviously. When you're working with your doctor can, based on our suggestions, provide the antibiotics. But even if you don't have a local healthcare practitioner or specialist, or your specialist is not a medical doctor, that's also very important because we work with healthcare specialists that are not medical doctors as well, that they're very effective in dealing with infertility. In that case, we can help because we can also send prescriptions, um, or offer follow-up consultations to discuss the severity of the results. So we are not going to leave you hanging with just
Mm.
a result that you're unsure of how to interpret. We are going to be with you all along the way. So until you resolve the problem.
Yes. And so, talking of that, do you retest? Because sometimes I feel the issues are with when you've got problematic microbes is that sometimes a course of antibiotics isn't enough to
Hmm.
treat. So how do you, because we see lots of people in clinic, for example, with repeat BV, and they've had
Hmm.
years and years of antibiotics, and it never quite clears. So how do you check that your treatment has worked and that the microbiome is repaired?
Depending on the type of the problem, we might or not require a retest. Now, when the problem is significant enough, and which means that you need to retest, um, we will first of all our treatment will be targeted. So we will use targeted antibiotic treatment based on exactly what you have, and then we will retest to see how successful it was. Many times you don't get successful treatments because you use generalized treatments that are not the correct ones, depending on what you are having.
Yeah. So you can sort of check to make sure that it's worked and that the antibiotics have worked so that the microbiome's restored.
Definitely. Yes.
Okay, great. And so I know we talked about this a little bit before, but can you just tell us so we're clear? Because often with testing, I think, there's always that line between over testing and spending lots of money that you don't need to on tests versus people not being aware that there are tests out there that they can do. There seems to be like two big camps when it comes to testing. So who would you recommend take these tests?
So, first of all, the simple answer would be anyone who feels that they would benefit. I'm very pro people making their own choices. I myself have been on the wrong side of doctors trying to protect me from expenses, which I would have been otherwise willing to spend to get some information earlier. What we do is that we give the options, we give all the information to patients in order to make an informed decision. Now, um, I I wouldn't necessarily suggest that everyone should start having microbiome test specialized testing as to be proactive. I don't believe that this is really necessary. Um, But when you feel that you start struggling and it's becoming a problem, and definitely before you start spending money or fertility treatments, which can be very expensive and very have a major impact financially, logically, and physically on you, I would at least the microbiome test would be essential. This is our first go-to test. So when you first feel that you might be starting hitting a wall with traditional testing, the conventional testing, then I would strongly recommend going this route. If you want to be proactive and have the test earlier, with pleasure, don't have a problem. But definitely, when things start to seem a little bit difficult, then definitely go for it.
Yeah. And I presume that this test is for people who are trying to conceive naturally, and perhaps people who are in IVF, and maybe they've had failed rounds of IVF or implantation failure, like we spoke about before. Again, this would be a test to consider in that situation.
Yes. So this test applies in all situations
Yeah.
because it
Okay.
has to do with the uterine environment.
Yeah.
So whether you are attempting and failing naturally or through IVF or independently of the way, you need to make sure that the uterine environment is ready to receive the embryo.
Yeah.
Either natural or so it applies in all situations, and it's very common for us, for couples that are in the process of doing IVF, having our test done in order to improve the success with the IVF, treating the problem, and then getting pregnant naturally.
That is so interesting. And I know that lots of people will be listening to this. We're doing quite a few episodes with information in around recurrent loss and miscarriage. So I know that lots of people listening will be really interested in it from that point of view as well. Dr. V, thank you very much for your time today. I really appreciate it. It's great to have you on the show. So I will see you again soon. Thank you. We hope you have found this helpful. If you'd like more on fertility education, please see our Teaching to Conceive free course linked at the end of the show. You'll also find the link to join our community. For more personalised fertility support, you can work with us one-to-one in clinic and online. You can book a discovery call to find out more.